The most important thing that the world is concerned right now is the outbreak of the new COVID-19 virus, also called coronavirus. The virus has killed thousands of people worldwide and has spread to many countries around the globe. In this video, we will look forward to the frequently asked questions about the coronavirus.
What is coronavirus? Coronaviruses are a large family of viruses, some causing illness in people and others circulating among animals, including camels, cats, and bats. The 2019 novel coronavirus, COVID-19, is a new virus that causes respiratory illness in people and can spread from person to person. This virus was first identified during an investigation into an outbreak in Wuhan, China. What are the symptoms of coronavirus? Symptoms of the COVID-19 can include fever, cough, shortness of breath. The symptoms may appear in as few as 2 days or as long as 14 days after exposure. Reported illnesses have ranged from people with little to no symptoms to people being severely ill and dying. How can the coronavirus spread? Human coronaviruses spread just like the flu or a cold. Through the air by coughing or sneezing. Close personal contact, such as touching or shaking hands. Touching an object or surface with the virus on it. Occasionally, fecal contamination. How can I help protect myself? Prevention. Cover coughs or sneezes with your elbow. Do not use your hands. Wash hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if soap and water are not available. Clean surfaces frequently, including countertops, light switches, cell phones, remotes, and other frequently touched items. Contain. If you are sick, stay home until you are feeling better. Should I wear a mask or respirator in public? The CDC does not recommend wearing masks or respirators outside of workplaces settings, in the community. A respirator is a personal protective device that is worn on the face or head and covers at least the nose and mouth. Most often, spread of respiratory viruses from person to person happens among close contacts, within 6 feet. It is important that these devices are readily available to healthcare workers and others who need them. Should I cancel my international travel because of novel coronavirus? The CDC recommends avoiding all non-essential travel to a country with a Level 3 travel advisory. What about animals or animal products imported from China? The CDC does not have evidence to suggest that animals or animal products imported from China pose a risk for spreading COVID-19 in the United States. This is a rapidly evolving situation and information will be updated as it becomes available. What is the risk of my child becoming sick with COVID-19? Based on available evidence, children do not appear to be at higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases to date. Are the symptoms of COVID-19 different in children than in adults? No. The symptoms of COVID-19 are similar in children and adults. However, children with confirmed COVID-19 have generally presented with mild symptoms. Reported symptoms in children include cold-like symptoms, such as fever, runny nose, and cough. Vomiting and diarrhea have also been reported. It's not known yet whether some children may be at higher risk for severe illness, for example, children with underlying medical conditions and special health care needs. There is much more to be learned about how the disease impacts children. Is the COVID-19 same as SARS? No. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome, SARS, in 2003 are related to each other genetically, but the diseases they cause are quite different. SARS was more deadly but much less infectious than COVID-19. There have been no outbreaks of SARS anywhere in the world since 2003. Is there a vaccine drug or treatment for coronavirus? Not yet. To date, there is no vaccine and no specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Most patients recover thanks to supportive care. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. Who is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19? How long does the virus survive on surface? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. This may vary under different conditions, e.g. type of surface, temperature, or humidity of the environment. If you think a surface may be infected, clean it with simple disinfectant to kill the virus and protect yourself and others. Clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, mouth, or nose. Can humans become infected with the COVID-19 from an animal source? Coronaviruses are a large family of viruses that are common in animals. Occasionally, people get infected with these viruses which may then spread to other people. For example, SARS-CoV was associated with civet cats and MERS-CoV is transmitted by dromedary camels. Possible animal sources of COVID-19 have not yet been confirmed. To protect yourself, such as when visiting live animal markets, avoid direct contact with animals and surfaces in contact with animals. Ensure good food safety practices at all times. Handle raw meat, milk, or animal organs with care to avoid contamination of uncooked foods and avoid consuming raw or undercooked animal products. These were the most frequently asked questions about the novel coronavirus. Share this video with your friends to make them aware about some facts about this deadly virus. If you found the video interesting, please like and subscribe.